All right, Bismillah Rahman Rahim. Assalamu alaikum and very good evening to everyone joining us today. I'm truly delighted to welcome you all at platform of Saudi Society for Medical Education again with a little break. Today's topic is really very interesting in way that medical professionalism and mental well-being in health professional education. It's not only timely, I think this is very much essential topic to be covered for health professional educator. I'm Dr. Shazia Iqbal and I'm going to moderate this session for you today. As medical educator, we operate in very high pressure environment, no matter that is a clinical setup, no matter that is a teaching setup. Yes, that is very much high pressured environment and where professionalism is expected at all times. But have we paused to think about how these expectations impact the well-being of our learners and indeed ourselves, especially our own health? So we thought that this session is very much essential to learn more about how the intersection between professionalism and psychological resilience can be enhanced among health professional educators. So this is a session where you will learn about core principles of professionalism in healthcare. We shall learn and explore more about the standards and framework that how learner mental health and emotional well-being can be improved, what could be the potential challenges and strategies in balancing professionalism and well-being. And now it's an honor for me to introduce to our distinguished speaker for the evening, Dr. Kamran Baloch. Dr. Kamran is a proud medical graduate from LMC, Pakistan. He holds a master's degree in medical education from University of Dundee and a PhD in medical education from Malaysia. He is also a fellow of Academy of Medical Educator, United Kingdom, and a well-deserved recognition of his commitment to excellence in health professional education. His academic journey has revolved around two crucial themes, that is medical professionalism and student well-being. He has already published more than 50 articles in well-renowned journals. He had been keynote speaker and workshop facilitator at various regions all over the globe, including Saudi Arabia, Malaysia, United Kingdom. Very warm welcome, Dr. Kamran, to this forum, and I'm very much pleased to welcome all of the participants for today's session. Let's make it very much engaging learning experience and more interactive. Questions will be taken by end of this session, and at the end of the session, you can raise your hand, you can chat, you can get engaged into the discussions. And over to you, Dr. Kamran.
Thank you so very much. Jazakallah khair. Bismillah ar-Rahman ar-Rahim. Bismillah, alhamdulillah, salatu salam, Sayyidina Nabina Muhammad wa ala alihi wa sahbihi ajmain. I would like to begin by expressing my sincere thanks to Saudi Society for Medical Education. I would like to uh, especially thank the moderators, Dr. Ali and Dr. Shazia, for being constantly in touch since long time and for inviting me and for this generous introduction. I would like also to thank all the participants. Thank you and welcome all of you for here for this important discussion. Um, this discussion is important for the reason because as healthcare professionals, we all as educators, we recognize that medical professional is at the heart of our practice. And every day we interact with patients, with colleagues, and beyond colleagues and patients, we also interact with society, whom we are responsible actually at large. But in today's demanding healthcare environment, maintaining professionalism while safeguarding our own mental well-being has become a challenge actually. This brings us to the core objective of our today's session. Therefore, today we will together strive to understand the core principles of medical professionalism in healthcare professional education and also try to explore how medical professionalism and mental well-being are interlinked. We will then try to look for strategies to nurture professionalism and the roles of coping in mental well-being, so that we can learn how to properly maintain a balance, a delicate balance between professionalism and mental well-being issues. So, before we together dive in, let's pose a question to ourselves. Have we ever felt uh, that the expectations of being a professional sometimes conflict with our own well being? And keep in mind that this very dilemma is central to our discussion today. One of my third year medical students, once I saw him in the corridor and he really looked very tired and exhausted, probably because of his endless study sessions, probably because of his demanding clinical rotations. And keep in mind that I have known to him for the last 2 years, and he's always been a very dedicated, a very disciplined student, actually. But when I asked his reason for being so unrestful, he bravely asked me back. He said, Dr. Kamran, you always have been saying in the classes, in the teaching sessions, that medical students have to be in medical school because it's a prestige, and being a medical student within medical school environment is a journey of dedication, a journey of discipline. It's a lifelong learning, but at what cost? So when he asked me that at what cost, this really was a quite a question for me. Because as students strive to embody professionalism, their own mental well-being is often put to the test. Can we create a system where both these elements of medical professionalism as well as mental well-being elements can thrive and nurture together? So let's explore this delicate balance today. We often much talk about professionalism as a core value in medical education, no doubt about it. But do we talk enough, and do we discuss, and do we search, and do we explore enough about the emotional toll or emotional burden it takes? If students or the learners are expected to care for others, shouldn't we also ensure they can care for themselves as well? Today, we will discuss how professionalism and well being can and must coexist. In my personal, humble opinion, having a balance or striking a balance between high standards, that is professionalism, and well being, is not just a personal goal. It's not a single person's or a single entity's responsibility. It's a combined teamwork. Moreover, it's an institutional responsibility. So let's dive deep into this important conversation together. So, is concern about professionalism or professional behaviors really something new? Well, not at all. Since as early as 1812, there has been a huge, or we may call it humongous volume of literature on this topic. And just this year, in 2025 alone, nearly 11,000 documents have already been published on this particular topic. That's a staggering amount of research. Now, let's go back in the time to Sir James Paget. He was a very well known figure in medicine. Many of us might or must have known to this name because he was very famous for describing carpal tunnel syndrome, Paget disease, and many more terminologies he has created for his name. In 1869, you see, in 1869, he wrote a remarkable piece of article. And the title of his article was What Becomes of Medical Students. In that particular article, he discussed in detail about the number of students and the importance of maintaining both a professional and personal reputation. Later on, Lancet described this article as brief and brilliant. His insights remind us that concerns about professionalism in medicine are not new actually. They have been around for generations. for decades. So basically, looking at this slide, we can conclude that concepts of professionalism is not new. And this concept is overwhelmingly interesting because this concept is ever evolving. But at the same time, this particular concept is profoundly challenging as well. Unfortunately, till the date, or we can say at present, at least we can say, we don't have an unanimously globally agreed definition of professionalism, but we have rather a compilation of qualities that demonstrate an individual's competence, and that could be due to that there could be many other reasons, but what literature informs us that the main reason could be due to the commonly occurring culture differences. And literature also informs us that there lies culture differences in professional standards, but we have to be very much carefully determining about these differences, because much of these differences in medical professionalism across cultures lies in emphasis rather than definitions. So why we are just telling it that definitions are not much having differences, rather the emphasis is more important, because in Western definitions, they mostly emphasize more on societal issues and patient rights, whereas Middle East definition, they emphasize more on morality and personal character. On the other hand, East South Asian definition, they are more emphasizing on respect, responsibility, and duties. So similar conflicts prevail with confidentiality and privacy concerns as well. We all know the right to privacy is inherent to human dignity, and together with freedom and private life, it actually signifies respect for the individual's autonomy. Because without expectation of privacy, patients might not disclose any important or confidential information, or they may avoid seeking care. But we have to accept that, as a matter of fact, for instance, Chinese and American bioethics also differ largely due to the influence of Chinese Confucianism and Western religions, respectively. And there is a lack of comparative studies so far that could have explored many cases of ethical dilemma between China and the United States as well. Once I have come across an interesting argument that I would like to share with you, that and it is available in the literature, that ethical dilemmas have often occurred in China due to the late development of their bioethic framework. But then how can someone digest the fact that bioethics in US was present earlier than in China, but still US could not spare of ethical dilemmas as well. Another important element of our today's discussion is mental well-being issues. And mental well-being issues among medical students are getting common. Their relationship to medical professionalism is now debated very oftenly. In the year 2023, we published a study and we found that unfortunately, empathy, that is the core of medical professionalism, among medical students tends to decline actually during the period of their academic burnout. So when there is academic burnout due to any pressure, any peer pressure, any academic stress is getting into getting students into the burnout phase, their empathy is getting declined. This underscores the importance of addressing and exploring the factors contributing to burnout so that we can preserve the empathetic qualities which are truly essential for our medical students to nurture their medical professionalism. When we look at the national and international perspectives, we have come to know, and we have to start believing that professionalism is a culturally sensitive construct. It is therefore interpreted and articulated under regional norms, religious beliefs, and cultural practices. So these all interplay to define a local professionalism. Because of this, there is now a widespread movement towards rethinking the way uh, professionalism in any society can be nurtured and assessed. And now, um, presently, professionalism has become an integral part of medical training all over the world. So, how this particular aspect have gained so much attention? Because this question definitely has to rise in our mind. So all such attention gained by medical professionalism is due to contemporary evidence about frequent unprofessional behaviors that has been observed across the globe, all over the world. And now it is apparent that professional misconduct among medical students have become a pressing issue that can lead to serious consequences, including even dismissal from training programs. Therefore, now available literature suggests that regular teaching and regular assessment of professionalism are essential so that their impact on students can be gauged, and we can ensure that respect and competencies are prioritized, and medical training across various countries now have been starting focusing on the frameworks where they can be implemented in their existing curricula. Fortunately, there are various frameworks which help us to um, make sure that we can nurture and assess professional behaviors. For example, um, American Board of Internal Medicine's framework, and their acceptability in local settings is also evident from the literature. And we have seen that in UAE, American Board of Internal Medicine's framework has been underscoring its need with clear standards of professionalism in the local context, which can fulfill and fit in the local needs and local contexts. When we come to the practical challenges, we have seen that in resource-rich environments, means the areas, the cities, the organizations where mental health services are uh, appropriately being addressed with the support of government, and there are robust support system available. Um, for instance, the mentoring system, the counseling system. So learners can easily navigate their challenges, and they can get help whenever they need for their present and personal challenges, and they can uphold their professionalism to the quite a fair level. Whereas, on the contrary, in countries with limited access to the mental health services, medical students or learners at different levels, different stages in training, they usually face higher levels of stress and anxiety and burnout. This can negatively impact their academic performance, their well being, and also their ability to maintain professional standards. Actually, this is the reason we have to understand that lack of support can definitely lead to feeling of isolation, reduced resilience, and challenges in maintaining professional behavior. So these two particular major disparities in resource, if are happening, they would definitely result in unequal access to professional development opportunities such as training workshops on academic misconduct, or on the topics of communication skills, which are undoubtedly very essential for fostering medical professionalism. So actually, what happens? This all creates gaps in the preparedness of professional conduct for the learners at different levels. Coming to another challenge, uh, which is regarding access to healthcare service, and which can be whenever the services concerning healthcare services, if they are scarce or if they are, kind of like concentrated in urban areas only, which is happening these days in many um, countries, it makes it very difficult for students, for learners, even for faculty, especially those in rural or remote locations where the access to necessary medical care is very difficult. So, moreover, what happens in low resource settings, the cost of healthcare becomes prohibitive, and it leads to the students to delay or forego necessary treatment, which can negatively impact their health and ability to perform academically or professionally. And different countries have different healthcare systems, so different cultural and legal frameworks also shape what is considered professional behavior. This also leads to inconsistencies in expected norms, and also there is always a variability differences. For instance, in healthcare system, the priorities are different. Where some organizations emphasize on efficiency or profit or patient-centered care, that again can conflict with core professionalism's values like empathy and integrity and so on. Another significant challenge is maintaining the work-life balance. And this is of paramount importance actually for our faculty and for our learners as well. And we all, as medical educators in our academia, and teachers and mentors and facilitators, we are aware that high academic demands often leave the learners with very little time for our self-care, especially in some cultures that emphasize rigorous academic achievements. In many cultures, they always also like, what are your grades? What are your achievements? So, I mean, this pressure over time can be more pronounced, and it leads to neglect of personal health. So the learners, the people who are engaged with their academic achievement, they keep doing, they keep like, searching ways where they can excel in their academic achievements, just leaving behind their mental health, leaving behind their physical health, leaving behind their association with the society, and leaving behind all the social activities and so on. Other than that, in some culture, there is a stigma also around seeking help for mental or physical health issues. This also fosters and forces students to prioritize their studies and academic achievements over their personal well being. On the contrary, in cultures, there are still positive societies, positive culture is prevailing there, where mental health, mental well being is more openly discussed, more valued. So what happens there? The people who are attached with academia and the learners, they find it easier to seek a balance between academic responsibilities. They are easily seeking guidance and for their personal health, and they can get mentorship support. So we can say these practical challenges have long-term impacts and result in unhealthy work habits if their good support mentor system is not there. So it leads to chronic stress, burnout, and work-life imbalance, which ends up in decreased empathy, poor communication. For instance, it leads to poor decision making and nevertheless reduce job satisfaction in the long term as well. We all know that medical professionalism has always evolved alongside the practice of medicine. And these shifts actually over time has been arisen, and these have created opportunities to redefine and strengthen professionalism in ways that is still at the core focus on providing high quality patient care, especially in today's changing medical landscape. So today's professionalism is evolving. How does it has evolved? It has evolved to meet new challenges because medicine itself is shifting now. And we all believe and we have moved from autonomy to shared accountability. Now we all know that it's not just about an expert's opinion anymore. It's about evidence-based practice. And of course, there is shift from solo practice to more of a team-based approach, which is how modern healthcare is functioning now these days. So, therefore, now professionalism itself is not just a buzzword anymore, right? So, because now we are aware that it symbolizes this whole set of skills, values, behaviors that define what it means to be a good doctor. And as we have been reading a lot, that American Board of Internal Medicine, as it states, or it entails that professionalism means altruism, accountability, commitment to excellence, duty, and a real commitment to service, honor, and respect for others. And these are our attributes that no matter where you go in the world, these would be expected in today's medical student. These would be expected you as a medical educationist as well. But at the same time, there is this another important element we cannot ignore, which is known as mental well-being, which plays such a critical, crucial role because honestly, if you think about it, the mental well-being of medical students is the foundation of any future healthcare system. And if we look at what World Health Organization has defined, Mental health is not just absence of disorder, it's actually about a state of well-being where every individual realizes and understands their own potential and also can handle the normal stresses of life and also can work productively and also can contribute to their community. And the impact of mental well-being is so huge because if medical students are not in a good place mentally, how they are supposed to care for others. According to Dr. Hans Selye, who is commonly known as the founder and father of stress theory, he once said that it's not the stress that kills us, it's our reaction to it. Probably he was referring or indicating on how we deal with our mental well-being issues. But one thing is for sure that psychological stress and burnout among medical students are prevailing, and we all have evidence for it. One probable cause could be the demanding medical curriculum. That's why medical students undergo a lot of psychological changes. According to the extensive findings, literature suggests that students undergo stress, anxiety, depression, as well as burnout. And undoubtedly, undergraduate medical students, graduate medical students, even the faculty members, as a lifelong learner, everyone is facing significant stress. And with burnout becoming all too common in our medical schools. Disturbingly, results from a study among Saudi medical students informed us that 11.5% of students report mild depression, 4.9% have been experiencing extremely severe symptoms. So, even more concerning is that 29% of students were classified as experiencing extremely severe anxiety. So, this all highlights a critical issue that needs our immediate attention. Long ago, in a book, I just forgot the name of that book. I read somewhere that the absence of stress is death. Only the dead have no stress. So, in other words, every living person have to go through some stress, physical or mental, whatsoever. Now, it's more important that how we deal with that particular stress. Now, let's look at the literature from around the world, which has definitely highlighted the growing problem of unprofessional behavior. At the same time, student learners and trainees in medical school, in medical training, they frequently report having mental well-being issues. We can see that a growing body of research also shows that coping significantly impacts mental health. So as you can see here, professionalism really needs to be nurtured from the start, from the very beginning, right from medical school. The GMC actually highlights how important it is to build this foundation during those early undergraduate years. But with the rising pressure and stress students face, we are noticing more unprofessional behaviors. And when coping is not effective, it doesn't just affect professionalism. It also impacts their communication skills, mental well-being issues start arising, and it's all are interconnected. Let's make an assumption here. If there are shared decisions, and that has to be an ideal situation. When we say if we cannot have ideal professionalism, at least we should have optimal professionalism. But let's think about an ideal situation. If there are shared decisions and responsibilities fulfilled by all stakeholders, like students, school, administrators, all hierarchy from top down, they all are involved in decision making and responsibilities are being fulfilled by all of them. And if appropriate curriculum reforms are considered for any medical organization, institution concerning medical education, then only student will know how to effectively cope with their mental well-being issues, and definitely they will become professional students who definitely will care about themselves, their patients, and the community as well. So, if we can try working on this assumption, this might help medical schools and our society plan appropriate strategies to produce well-being doctors, good doctors, safe doctors who can care for the patients, for themselves, and the community needs would be fulfilled as well. While dealing with the objective in today's session to find an association of medical professionalism and mental well-being, we have to be very careful. We have to be very vigilant. When students enter medical school, they come up with this very deep sense of very uh, positive, noble purpose, the desire to help others. But let's be very honest. The reality of medical training is intense. The workload, the long hours, the emotional demands, it continuously adds up. And when students start feeling overwhelmed, whether it's due to stress, anxiety, or burnout, it can seriously affect their ability to uphold their key professional values like empathy, integrity, and of course, effective communication. Think about it. When you are mentally exhausted, it's just harder for you even to be fully present for patient. It will be very difficult for you even to work well with your colleagues or even to make the best ethical decisions under pressure. And here is the thing. Professionalism is not just about how students behave, it's also shaping how they feel. A learning environment that is having respect, element of respect in it, like environment which is respectful, environment that's providing good mentorship, and most importantly, making students feel psychologically safe. That kind of environment can build resilience and motivation. On the flip side, though, if the culture is too rigid, too high pressure, and honestly just unforgiving, that's when we start seeing students struggling emotionally and at all. So, really, medical education needs to strike that balance. It's not enough to teach professionalism, students also need to experience it in a way that actually supports their mental health, actually. So, any student who feels mentally well is far more likely to act professionally. And a truly professional, ethical learning environment, in turn, will help protect the students' well being, which will definitely reflect later on how he or she is going to deal with his patient and beyond patient, the society, and the environment he or she is working in. So, what is the bottom line here? These two things, mental well being and professionalism, are not separate. They feed into each other. If you want to produce doctors who are not just skilled but also compassionate and resilient, we have to prioritize both. So let's work towards a system that takes care of its students because that's the only way we ensure they can take care of themselves and others at the same time. Behaviors are equally important for medical professionalism because behaviors can be measured, behaviors can be assessed and monitored. Behaviors are equally important for mental well being as well because mental well being directly impacts behaviors. Any compromise in well being can influence professional conduct and behaviors. At the same time, behaviors themselves are essential for maintaining good mental health. To understand what drives human behaviors, we can refer to UNICEF's behavioral drivers model. This model categorizes into three areas: psychology, sociology, and environment. So we can see here the psychology plays a key role, and we see that people don't always make rational decisions. Sometimes they act out of habit or based on emotions rather than logic. When we see on the category of sociology, we see the sociology tells us that our behaviors are shaped by social norms. We are mostly influenced by the people around us and the expectations of our communities. And while looking at the category or the element of environment, we know that environment also matters. And by environment here we mean institutions, laws, governing bodies. They all shape behaviors by setting rules, by enforcing norms, legislations. So Understanding these behavioral drivers by the name of sociology, psychology, and environment, we will help ourselves to better understand for getting support for both for professionalism and well-being in medical education and practice. In my personal opinion, uh, anyone can object, anyone can disagree, but I have a personal opinion that the sociology and environment category in this slide is actually related and emphasizing and highlighting the critical role of role modeling and hidden curriculum, which every one of us is well aware of for nurturing professionalism in medical education. Because as educators and mentors, as as teachers, our actions, our attitudes, our personal ethical decision makings, our personality, our characters shape the professional identity of our learners, often more powerfully than what we say, often more powerfully than any textbooks or lectures. On the left hand side, through this qualitative phenomenological study, we explored relationship between mental well-being and professionalism and coping strategies among 234 medical students in University of Science Malaysia using structural equation modeling. We found that professional behavior reduces burnout and negatively impacts negative coping strategies. Conversely, psychological distress increases negative coping and reduces empathy. We also found that positive coping strategies were enhancing empathy. And it highlights that it's very important for fostering professionalism and effective coping mechanism so that we can improve mental well-being. On the right hand side, we have also conducted another quantitative correlation study, which has allowed us for rigorous examination of causal relationship and complex interaction among these variables. It has provided valuable insights that has confirmed and informed us about practice and policy. Uh, in this study, our theoretical framework has shown us that existing literature was revealing about scarcity of evidence regarding the impact of mental well-being issues on professionalism of mental well-being. And current reports really have failed at that time to adequately explore the causal relationship model and causal relationship between these two critical domains of mental well-being and medical professionalism. Additionally, there is notable gap, a huge gap in our understanding of the role of coping mechanism as a mediator in the relationship between mental well-being indicators, including stress, anxiety, depression, and burnout, and also as the attributes of medical professionalism, such as professional behavior and empathy. We have highlighted some more detailed and simplified results in the next slide, which are here, which presents a model illustrating the causal relationship between mental well-being issues and medical professionalism. This table on the left outlines various terms and concepts emphasizing interconnectedness of psychological distress, burnout, empathy, and professional behavior. I think understanding these relationships is crucial for developing effective interventions to support medical students' well-being and professionalism both. And this model that was created in our research, it has shown us that causal effect relationship really exists between mental well-being issues and medical professionalism. And we can see that professional behavior was an inhibitor of burnout, while psychological distress was also being inhibited. At the same time, psychological distress was contributing to burnout and reducing empathy. To ensure our findings uh, were consistent or not with the published studies, we have examined contemporary research also, and we found that medical professionalism really decreased the burnout level of medical students. And this was in line with other studies which determined a negative correlation between professionalism with burnout. We also found that psychological distress also increased burnout, and we have evidence from other published studies that there is a positive association between burnout and psychological distress. we successfully found that psychological distress was decreasing empathy. So whenever there was stress, empathy was being declined. Similarly, available literature indicated that psychological distress again negatively affecting physicians' ability to empathize with their patients. And this was quite alarming. Another objective which we have today was how to nurture medical professionalism. The big question for us is where to start. We have observed that most medical schools nowadays address and remediate unprofessional behavior in students, in their learners through a combination of structured curricula, proactive interventions, and they foster a supportive educational environment. So these strategies aim to instill professional values and rectify negative behaviors, which in turn may ensure that future healthcare professionals uphold the standard of medical practice. But we see that when medical schools implement organized courses on professional behavior, which are integrated throughout the medical program, these courses uh, at the beginning start with the introduction of for students to philosophy of professionalism. They then later on they emphasize strict compliance with professional standards from the onset of their education. This also helps the faculty members also to get trained to assess students consistently throughout the curriculum. So the structured approach is very important actually because it has been showing to improve professionalism grades over time. Another approach is to address the hidden curriculum, and it's very important, which includes unspoken culture and social norms. You know, we have formal curriculum being addressed, informal curriculum being addressed, but how about hidden curriculum? So we have to address this hidden curriculum element as well. Therefore, promoting a curriculum which has to see all elements, like um, structured curriculum has to be there with focusing on formal, informal, hidden concepts, as well as situated learning has to be focused, and experiential learning that has to go on outside the classroom as well. While these coping strategies are prevalent, reliance on avoidant method can also lead to increased stress, and we have to be very careful if we see in our learners if they are having some avoidance method they are being utilizing for coping with their stress uh, or anxiety, and which actually highlights the need of targeted intervention to promote their healthier coping mechanism among the students, because sometimes they start utilizing negative coping strategies as well. And we have many, and like positive coping strategies with the name of problem focused, which have examples like um, time management, where students often utilize effective time management techniques to balance uh, their academic demands. Students also try their seeking academic supports from their seniors or from counselors by engaging with peers and faculty for getting help. And this strategy is particularly more common among first year and first to second year students who face adjustment challenges at the beginning of their courses in medical program. Next category is emotional focus, where mindfulness and relaxation techniques are being utilized. They are very helpful. Many students practice these techniques to alleviate their stress, which has been shown to enhance their emotional regulation as well. Then comes social support, and here we can see interpersonal connections such as spending time with their friends, with their families, and these also prove to be very crucial for emotional upbringing actually. Unfortunately, as we have just uttered that another category which is known as avoidant is also being practiced, which includes substance use, and some students resort to maladaptive or negative strategies like excessive substance abuse, and these can exacerbate stress levels. Now, with the digitalization, now these days we have start seeing the gaming. Gaming has also emerged as a coping strategy where students or learners, the people who are being burned out, keep involved, keep getting engaged in gaming actually. And they start feeling that they are feeling better, but instead, and they keep involved so much that they spend so much time that they are having, they are utilizing so much of their important time in gaming that at the end of day they start feeling again stress and burnout while spending much time on the gaming. So they are not getting any positive outcome out of it. Venting and humor are also frequently employed, particularly as we had observed during challenging periods in the past, in the recent past, in the time of COVID-19 pandemic. Let's see what strategies can faculty members employ to promote culture of mental well-being among their learners while maintaining professional standards. So we can see that promoting a culture of mental well-being among their learners while maintaining professional standards, faculty members can simply implement several strategies approaches. Like these approaches, strategies can focus on creating supportive learning environment, collaboration, resource integration, co-designing of well-being strategies where everybody would come and discuss and give their priority and preferences. Supportive learning environment has to be there. And one of the most impactful ways we as faculty, as academician, we can support students' mental health is by showing genuine care. Something as simple as checking in with the student, simply we can ask how they are doing. So especially during stressful exam periods, this simple gesture can make a huge difference. In my experience, a medical school professor once noticed a student, he was struggling, and he simply said, "You seem overwhelmed. Is there anything I can do to help you?" And that small gesture really led the student to seek timely support. Collaboration and resource integration is also very important. While mental well-being is not just an individual effort, we have to keep in mind it's a collective one. Some medical schools have embedded mental health services within academic departments, so students don't have to, seek help separately. A great example is a program where faculty members collaborated with help, and faculty training again comes in. It's equally crucial where educators understand signs of burnout. At least they are so basically trained, they can direct students to the right resource. I recall a faculty member long ago who attended a mental health awareness workshop and later identified his student who was at risk of severe anxiety. And because they knew the right steps, they helped that student find support before things escalated. So, if a person who is teaching, who is in command, he himself knows the risks of his students being going through, at least he can guide him well. So these all things are important that as a faculty we have to bear the responsibility. As academician, we have to just take care of our students, because more we will take care of our students, the more productive uh, they are to be. For the objective of balancing medical professionalism and mental well-being, we as a faculty members and mentors or clinicians and also as academicians must focus here on the programs and curriculum integration, which is very important. They work as the strategies to balance professionalism with mental well-being, because there is much evidence. There is a great deal of evidence in present published literature which favors positive coping mechanisms such as mindfulness practice, because it significantly enhances students' resilience. These strategies are very important, crucial, essential for developing and creating a culture or an environment that prioritizes mental health alongside professional development in medical education. The balancing strategies should do one thing. All these balancing strategies should focus on enhancing coping mechanisms, and it will foster a supporting learning environment, and it will help implement structuring well-being programs. So if we look at the coping strategies, we'll get to know that it's very important to encourage students to seek support at the first moment from their peers, mentors, or the counselor. So whatever resources are available, we have to guide our students, direct our students towards that particular help center they can go and get in touch with, so that they can enhance their mental well-being at the very beginning, at the earliest. And their professional behavior additionally would be like, incorporated with their mindfulness and meditation or whatever suggestion they would get from that particular support system. If we have to foster support, literature suggests that we have to establish formal well-being programs with dedicated leadership, which can create a central hub for resources and support in addition. So here comes the role of institute of administrations and senior hierarchy, which can just make sure that the support system is available in the institution, which integrates well-being education into the medical education curriculum, which definitely is required to help students develop resilience and their coping skills. Ultimately, it will improve their professional conduct also. But the journey of responsibility, mm, as I said in my very first slide, that this journey of responsibility doesn't stop here, and it's not the journey where a single person can have a solo flight. This journey of responsibility has to be continuous, and there has to be continuous evolution of well-being program. It's very crucial. So regular assessments of well-being initiatives are required to ensure their effectiveness and adaptability, so that students would get what they need, and all must be carried out, all steps, crucial steps must be carried out at the institutional level without any lapses. The conflict between professionalism and well-being is significant challenge these days for us all. So whenever our learners, we see them, they are trying to approximate, to match high academic performances with their professional expectations. It's always we see that it's always being hindered due to personal or what we may call natural individual limits. So what happens next as medical professionals? When we step into a world of high expectations, we are expected to be very competent, very compassionate, and always we are trying to be at our best. But in striving to meet these high ideals, we often push beyond our personal limits. We ignore our own exhaustion. We ignore our own well-being. This pressure builds up and excels and becomes so ingrained that slowing down for us feels like we are having some failure. And it's not true. It's but natural. We have to adopt it. We have to know that if we are slowing down, it's not our failure. It's but natural. Even when our mental or physical health is at stake, we try to keep rolling down to the road, thinking that it's something that we have to go on. No, we should know the reality. This actually leads to emotional toll of patient care. Simply because every difficult diagnosis we deliver, every lecture we take as an academician, every difficult um, diagnosis we make during our clinical settings, every family we console, or every loss we witness, it actually chips away at us, some part of us. So we are taught to be very strong for our patients, but rarely we are taught how to process this emotional burden we carry. Over time, what happens? This unspoken grief that we don't speak to anyone, we don't share with anyone. This grief and moral distress accumulates, affects both our personal and professional lives. This damage further goes on, and culture and institutional pressure makes it even harder for anyone to bear. Unfortunately, many of us work in environment where exhaustion is seen as dedication. So when we see some of our colleagues really exhausted and tired, is like, shoulders down and moving in the corridor, walking slowly, and we appreciate and say, wow, you are very dedicated. Wallah, what is this? I mean, I don't know why we love to live in an environment where admitting to stress feels like admitting to be a weak person, where seeking help is a taboo. It's all wrong. We have to just change this mindset trap. This mindset trap, professional are in this mindset trap, and uh, in this cycle of trap, we are being silently suffered. It makes it difficult to prioritize our own well-being without feeling guilty. So the real question is, how do we break this cycle? How do we redefine professionalism in a way that values both excellence in care and excellence in our own self-care? So now we have to look for the strategies for balance. We found that time management and prioritization is so important. We have to start seeking for mentorship and peer support for our students, for ourselves as well. Mindfulness and resilience are the most important thing that we have to work on. This slide here is for our references, and this is our last slide here. I would like to just uh, summarize, and you can say it is a takeaway that medical professionalism and mental well-being are not two separate entities at all. They both affect each other, they both are affected by each other, they are interconnected. A healthy, well supported medical student, learner, medical educationist, medical educator, faculty member is more likely to uphold professional standards effectively. So, if we prioritize our self care, it's not, it doesn't mean that we are unprofessional or we are selfish. So, prioritizing self care is not unprofessional at all. And emotional resilience, mindfulness, seeking support are very essential components of being a competent and compassionate healthcare provider. All institutions must foster or at least try to foster an environment that must be supportive for their learners, for all stakeholders, and medical schools, organizations, institutes should integrate well-being programs, mentorship, psychological support system into the curriculum. This shall bring about the required balance, which is very delicate actually, which indeed requires culture and systemic changes. So we should understand that if we are doing so, we are changing a culture. So we should understand that when we start addressing unrealistic expectations, workload challenges, and taboos, stigmas around seeking help, it will help nurture both professionalism and well-being. And definitely, a thriving medical culture today will, or thriving medical student, thriving medical faculty member, thriving, nurturing medical professional, medical educationist today will be a professional, empathetic member of the society tomorrow. And to get to that particular level, that ideal, optimal professional level, let's collectively advocate for an ideal culture that values both excellence in professionalism and personal well-being. I thank you all for listening to this long talk of mine. Thank you very much. Dr.
Uh,
Shozia,
yeah, thank you
mic
so
for you.
much. Thank you so much, Dr. Kamran, for this wonderful presentation, and the way you have taken us from the very beginning, from the historical perspective of development of professionalism, mental well-being, and then sharing quite good amount of evidence, including your studies as well, and interlinking between the professionalism and factor responsible contributing towards burnout. That is amazing. And do agree that in order to create a balance and that in order to reduce the stress factor among our students as well as among health professionals themselves is crucial to create a healthy educational paradigm. I'm really mindful about the time. So if there are any burning questions from the audience, please feel free to raise your hand, unmute, and you can ask or can write your question in chat box. Any questions from audience? Meanwhile, we are waiting for the audience question, if there is. I was really very much curious to know. You have very nicely mentioned that we need to create a balance between mental well-being and professionalism in order to create very much positive and productive professionals in future. Um, yes, institutions are hugely working to um, address the issues of students' well-being, as it's very common to see at institutions, especially in the UK, that a student well-being center and very much structured approach for personal tutoring, who are taking care of students' mental health and early detect depression, anxiety, especially around the exam time and post-exam era. However, it's not much seen for the health professionals themselves. So I would like to know that at your institution, is there any kind of initiative which address the professionalism concerns for the faculty themselves and mental well-being of the faculty themselves in order to address their issues and detect a bit early? So if you have any experience at your institution, or you can give some examples.
Yeah, I hope soon we are going to have such big support system at our level. But again, I would say that as initially I have stated that it's a common task and common need for all of us if we would be starting working towards this common goal of addressing these needs of our learners. Definitely, if you really start working towards a curriculum that is so supportive for our learners at the level of undergraduate level, at the beginning at least, definitely we will need first to train our staff, our faculty as well. I think that would be the part where we will start looking, and we will be at least knowing who are the expert who would be dealing with this course, with this curriculum content for the learners. At that time, definitely we would need, and we would be just planning, and we will be seriously thinking that there might be some need for people who are themselves in need in from the group of the faculty as well. So definitely, if we will be starting to look to work towards our learners as a byproduct, this definitely would bring our mind towards this important task. So I think
Yeah.
starting directly from this task would be a great challenge. But again, if you would be starting to work towards framing uh, a thorough, holistic curriculum for students' well-being, we
Yeah.
have counselors for students, but as you mentioned, for our faculty members, definitely we have to think about it. But again, I said, working towards a curriculum that would be fostering students' well-being, definitely at that time it would come as a byproduct as well for the faculty.
Yeah, absolutely agree. And you have very nicely mentioned that how to balance in coping strategies, mindfulness practices, which are really very much getting popular modules to be part of GMC curriculum that they are enforcing, that somehow either elective or compulsory courses, there should be some kind of mindfulness modules which should be introduced within the curriculum. And I think that is one of the best way, I would say. Um, so far, I don't see any questions or comments from our audience. And uh, if there are no more questions or any comment from the audience, I would like to ask my last question, and then I will end this meeting. And I hope that you'll be happy to answer this question, that if we say well-being program and we want to initiate at our own institutions, which steps we should take to initiate that well-being program at our institution, or how can we train our faculty on that?
Well, you see, like for every program, we have all basic steps that we start. Usually in the past, when medical education units were not developed in many institutions, so what was happening then? So the basically what they were doing in different institutions, they were simply developing and implementing, and the evaluation phase was not there. But now we have, like, many frameworks, many guidelines available. And if you see that now, basically, we always follow 6 steps guidelines for any program to be initiated. For step one, and if you see in the ME guidelines, you see we have for defining and agreeing on definitions first. So we will start from the start we will have to start to get definition of well-being, what is well-being and what is mental well-being issues.
Yep.
So first thing first, we will have to define for our
Yeah.
context, for our society, for our organization, agree has to be agreeing on the definition first. The second step would be developing a framework of the curriculum.
Yeah.
Simply. In the third stage, we can simply have to have models of learning, models of teaching, models of working together towards those particular goals. As a fourth step, simply we can have to work on that. Would that all team would be working as a formal or informal curriculum? So all
Yeah.
boundaries would have to be set. Next step would be that how to deal with the hidden curriculum agenda for that particular course of mental well-being.
Yeah.
And last but not least would be assessing and reassessing again and again and evaluating and getting feedback. So if we can follow all these 6 steps are available as any guidelines for
Yeah.
any course to be articulated and to be incorporated in any curriculum. So I think
Right.
these steps are very extensive,
Yeah.
explicit. Whenever you want to plan any educational experience, these are there, and these have got sound footing and
Great.
sound
Thank you,
support
Dr.
from the
Kaman.
literature.
Yeah.
So we can work on these
One
guidelines.
of the participants, they want to ask question. Yes, go ahead, Dr. Shahid. Dr. Shahid, you raised your hand. You disappeared. Meanwhile, there is one question in the chat by Raja that is there any role of life skills training in medical education for mental well-being? Role of life skills training.
I think I don't know, but with the live spill, if it is something that you are mentioning with the patient safety, what we have already in place, so definitely it has with the life skills. If they have got all the elements
Yes, Dr. Shahid.
where we are telling our learners that what are the basic skills they have to adopt, so definitely it has got.
Uh, Hi,
Yes,
good evening. Good evening. Can you hear me,
yes,
sir?
we can hear you now. Go ahead and ask your question, please.
Thank you very much. Not a question, but just for my own understanding. Dr. Kama, are you with us?
Yeah.
I'm hearing. I'm all ears.
Thank you. Um, just tell me how much is too much? How little is too little for a stress?
Well, this has to be then answered. It's a tricky question. I think it's been disturbing and challenging many psychologists and psychiatrists. So I think it this question needs to be more elaborately and eloquently being supported by some context, right?
Yeah. Yeah. Absolutely, you're
Do
right.
you want me to elaborate or what?
If you want to, it needs some context.
If you need to.
I mean, if you can provide an example that in which
No,
situation you are
for
talking
instance,
about.
let me tell you. For instance, nowadays, uh, in academia, the amount of the level of expectations are so high that you see it's
Agree.
people are nowadays as if they are barely meeting the minimum requirement
Hmm.
to get promoted, to sustain the jobs, to continue in academia. It's getting very challenging, and that's why this is bare minimum
Agree.
that you are doing. To
Agree.
excel, perhaps you need to do even, that's what they say, over and above. Unless you don't
Agree.
do over and above, when you say that, oh, a person looks tired, no, person is not looking tired. Person has been made look tired. Person has been given so much responsibility be to be tired, to look tired, and to end up being tired as well. You know what I mean? May it be
You know,
teaching, may it be research, may it be administration, all these different aspects. The
yes,
demand is so much. The industrial demand is so much that there is no limit of what is the limit. So how much is too much? There's never too much. They will always expect that, yeah, oh, this is bare minimum.
So, Dr. Kamran, if you can give us very
Actually,
quick.
this is where work-life balance elements comes in. And the same time, Dr. Shahid, I agree. I totally agree. So this is the reality, and here where organizations and authority has to just take step in. At the same time, it differs for every individual. So there is so much variability with
Yeah.
everybody's threshold to sustain actually.
Thank
It
you. We
still
need to.
remains a variable for every different person.
Yeah. Thank you. Thank you. So, yes, Raja, if you want to unmute and
Yes, yeah.
ask your question, please,
Thank
quickly.
you, ma'am. Thank you, ma'am. Actually, regarding this life skill, I asked the question. It is life skill is not regarding, not related to basic life skills. It is regarding the about the communication skills. There are 10 skills they mentioned in by the WHO, like scoping of stress, creative thinking, and critical thinking, and then empathy, communication skills. So my opinion is, will integrate these skills in these 10 skills in the medical education means that will give us some mental well-being among the medical students.
Yes,
Great.
definitely, Dr. Raja. I
Yeah.
totally agree because effective communication, at least, it's been considered as the foundation of medical professionalism, no doubt.
Yes,
Because you know why it builds trust with patient and fostering teamwork among colleagues is being done through communication. It
yes,
ensures safe, high quality care as well. So
yes,
we know a skilled communicator not only conveys knowledge but also
yes,
demonstrates empathy,
yes,
respect, and ethical responsibility. Without clear and compassionate communication, professionalism loses its essence. So impacting both patient's outcome and the healthcare environments. For communication part, definitely, it has
Yeah.
its role in it. Definitely.
Thank you so much. Thank you so much, Dr. Kamran, for this wonderful discussion. And thank you so much for all participants. So I really appreciate your time. And with this, I will end this webinar and have a great rest of the evening. Thank you.
Thank you very
Allah,
much.
Allah Hafiz. Bye
Allah
bye.
Hafiz. Assalamu alaikum.
Walaikum salam.